Welcome. Have you ever wondered what is it like to be a doctor? What is it like to go to medical school? Today, I'm excited to bring you my next guest, Dr. Randy Pai. Dr. Pai works for an emergency room south of San Francisco. Welcome, Dr. Pai.
Hi, Bo. It's a privilege to be here. You can just call me Randy.
Great, Randy. So, what is it like to be a doctor?
Well, it is very, very rewarding, and I really, really enjoy helping people, especially in their moments of suffering. I mean, no one chooses to come to the physician. They come to the physicians because they are in pain, because they are suffering. And while we may not be able to cure everything, being able to decrease their suffering and just to hear them out, I think that's quite a privilege. What a great job.
It sure is, especially being in an emergency room. I can imagine, a healthy patient would walk in and see you.
Well, you would be surprised. Actually, the run-of-the-mill can be quite mundane. People will come in with their generic headache or non-lethal chest pains, abdominal pains, and we work through those, as well as just a common cough and colds, but there are more drastic cases that come in through the door. And those situations simulate what you see on primetime TV programs.
So you don't see the heart flies across the table, fell into the trash can. It doesn't happen in the emergency room, does it?
Well, certainly I've not seen hearts flying across, but sometimes it can be shocking to see certain structures cut open. I remember when I was working in the trauma center in Denver, Colorado, that there was this gentleman that came in from an injury, and he had somehow cut open his scrotum.
Wow.
And so you see actually his testicles laid out. And that is certainly something very shocking. It's not something that you want to see ever again.
Wow, so what came across your mind when that happened?
Well, at that time, it's like, what can we do to salvage, to save this person's, testicles so that he can go on to have children and lead a normal life? So,
Happy ending, I hope.
happy ending, happy ending.
Okay.
Yeah.
So if I may, let's step back,
Sure.
back to college. For some of the viewers interested in going to medical school, any advice, tips on, prepare yourself during college?
Yes. I think that a major myth, I think especially among Asian families, is that you must go to a Ivy League school, big name school, and that you must major in one of the sciences. And that's not true.
Really?
Not true. You can actually major in anything. There are some prerequisites in biology and chemistry and physics you have to satisfy, but any major that accords you a well-rounded education can get you into medical school. Mm-hmm. And I also want to say that while a certain minimum in terms of grades and test scores are important in getting into medical school, I would say that nowadays that is not the most important criteria that medical schools will look for. They really are looking for people who are well-rounded. So I would advise our viewers who are thinking about perhaps a career in medicine, during your times in college, to maybe go out and see the world. Study abroad programs, volunteer internationally, just broaden your minds. Because I think if you have a broad life experience, you will bring better intuition and better empathy as you deal with other people. And I think these two characteristics are important in becoming a successful physician.
Well, that is very good news. So for many of you out there, so go ahead and take your art class, scuba diving, and you can still become a doctor. So in your case, when did you decide to become a doctor?
I think that that's a difficult question for me because it seems like it goes very far back. And I think even as far back as high school or junior high school, I always had the thought in the back of my mind that I wanted to become a physician. It's very possible that my parents suggested that, put that in the back of my mind. I think that's very possible. But I think it's hard for me to remember going all the way back. I think that for myself, I remember I always liked taking care of those around me, you know, my brothers, my sisters, my friends, even my lovely stuffed animals. So I think that for me, I always thought that that would be a good choice for myself as well.
And you use the word suggest, your parents suggested. You don't mean they pressure you?
I never felt that they pressured me into anything. I think that I am pretty self-motivated, and I think that I think a lot of times in an Asian family, the children want their parents to be proud of, you know, you want your parents to be proud of you. So I've always striven for, you know, good grades all along, and I think that set me up for a good career later on.
So translation, you miss out on a lot of parties.
I have to say I was not a partier. My parents never had to worry about me staying out late.
And if you do, must be in a library.
I probably was in bed by 10.
Really? So the day that you learned that you got accepted into medical school, where were you? What came across your mind?
That is a very momentous day because you know college nowadays takes, you know, like say 5 years, and it's a lot of competition. So it's a long process. Even the interview process of getting into medical school, the application process. So the day that I received word, I was actually vacationing in Taipei.
How nice.
And my mother called internationally. I picked up the phone. She gave me the news. And I remember I was jumping up and down. I turned around and I actually hugged my father, who was with me in Taipei at the time.
I see. So your mom was here in the U.S.
Correct. Right. And it's very memorable because I think as most Asian families can attest, you know, the fathers usually are more austere and stern. But I remember that that was a very, very close moment between my dad and I. We actually hugged. And we were very, very happy. And I think that, you know, thinking back, my father probably also thought in the back of his mind that, ooh, we're now saving $150,000 because Randy got into a California state medical school, so he can save bundles in terms of not having to pay for a private medical school program.
I see.